So I'll just do this letter for the NMC. So I'm writing today with real concerns. Sorry.
Go on. All right,
You've got this. Come on, Jenna.
come on.
Thousands of nurses, health and social care workers, counsellors, midwives, police officers, firefighters have reached out to me, paramedics, have reached out to me to say that they're not able to ask questions and they're finding that really difficult, that it's almost like there's an elephant in the room that we're not allowed to talk about.
I'm writing today with real concerns that there are thousands of nursing students, thousands of nursing students, nurses, midwives and nurse associates, and their real concerns are about the blanket COVID policy that are put in place, which are having a detrimental effect on staff, patients and family members.
Unless it's a certain conversation, and people are finding that really difficult because, as nurses we're told to think critically, we're told to question things, have a look at the research, have a look at the follow the money, the different views and things like that, the different sides.
These nursing and midwifery staff are on your register and feel like they have nowhere to turn. I'm asking for your support and clarification with either a meeting with me to address these points with 2 fellow nurses, or for you to send the register an email to clarify your stance without ambiguity or passing the buck on to someone else, as they have tried to seek support from colleagues, management, trusts and unions.
And science and research is always evolving. However, it feels like it's follow the science, but not that science. Like, just stick to this one. And people are becoming really, really frustrated and confused about that.
Nurses are trained in effective communication, and part of this is to avoid ambiguity, as confusion as it can be open to interpretation. Nurses have a responsibility and accountability, and this is drilled into us. And when we first qualify, we feel like we have the weight of the world on our shoulders.
And if it is that they do try and ask questions within the workplace, they're being silenced, they're being bullied, they're being labelled COVID deniers, COVIDiots, anti-vaxxers, and that's not the case. It's just they want it to make sense for them in their head, and they're being bullied and ostracised.
We ask that you help ease this burden and set an example to us for us all to be able to work safely within our code of conduct by communicating with those on the registration who pay an annual fee without question, and we ask for very little in return. But now we need you.
And with the vaccine, people are messaging me and they're in tears and they don't want it. They don't want it, but they've got, kids to feed, they need to buy shoes for the kids and they've got bills to pay and whatever. And they're being told that if they don't have it, they're going to lose their job. And this is jobs that people have trained years for, it's jobs that people really love and enjoy. And they're really confused by, the actual risk over the perceived media hype risk.
In reality, and although an unpleasant truth, we need to take off our rose-tinted glasses and have these conversations that this simply isn't happening for many. Many nurses feel like they're in an impossible bind to do the right thing and lose their job, or to simply follow orders, don't ask questions and remain in practice so they can do the best with the patients who they look after. Nurses are trained to ask questions, but there is a growing culture of silence where nurses are unable to discuss the elephant in the room without being told we are selfish, uncaring, anti-vaxxers, conspiracy theorists, or have mental health illnesses.
So I'm not trying to challenge anyone. I'm not trying to say that people haven't worked hard. I'm not a co-denier. But what I ask is that people who maybe don't understand what I'm trying to raise awareness for, or who haven't had that experience, don't deny the possibility that people have had a different experience to you. So I'm not trying to, take away the NHS nurses and the role that they've played and how hard they've worked and the sacrifice that they've made. or the people who have experienced tragedy because of COVID. I am not trying to take that away from anyone. I am not trying to challenge anyone in that way.
Since when did we go from saying that labels are unhelpful to let's put them on our colleagues? Because we either don't have the answers or the questions make us feel so uncomfortable that we use all sorts of tactics to silence each other. I have put the concerns of nurses who have reached out to me into 3 categories. 1, a heavy focus on audit and league tables without reviewing or assessing and becoming task orientated. 2, unbearable working conditions for nurses being bullied, ostracised, threatened with job loss and coercive practices, and many are taking sick leave due to this. And 3, poor practice, lack of compassion, cutting corners, which is to the detriment of patient quality of life and experience. But all of the responsibility for these practices are because of COVID.
But I am challenging this culture that's been created where we're self-censoring and we're not able to ask questions, which is what we were trained to do. And I find it confusing that, like, with questions comes improvement. Conflict shouldn't occur because of it.
These are examples that nurses have who want to work to their level of competence in the best interest of their patients. If you can please make your stance clear on these points for short-term support and then look into investigating the breaches of the code of conduct for long-term, nurses would feel reassured that they do matter and that their voices and concerns count.
I'm asking for your support now, I really am, because I don't know what else to do, and I feel that I personally need a little bit of support as well. So selfishly, I'm asking for you to join me on Nurses Day, which is the 12th of May. And I'm asking for all uniforms, if you don't wear a uniform, so like social workers, any health and social care worker, any services who have been impacted by the things that I talk out about and are pro-choice, pro-informed consent, voluntary consent, anti-fear, anti-coercion. You know, if our values aligned, then please join me.
So number 1, are nurses encouraged to use their professional judgment for the best interest of the patients, even if it contradicts government policy, and review patients holistically using person-centred care, risk assessments, evidence-based rationale, debate and patient quality of life? 2, will those on the register who whistleblow be protected and not be used as scapegoats or shamed for not coming forward sooner? 3, are there to be review dates in place for the use of masks and, for example, research into the negative impact of building a therapeutic relationship with individuals and childhood development and communication? Do members of the register have a right to choose to decline or to be part of the trial for the COVID-19 vaccines, which are authorised under emergency powers with no long-term safety data, and assess their own risk based on the information we have available from the previous 14 months, and to look at the individual's ability to maintain their own level of health to reduce the risk? I understand from your website that you state the vaccines are not mandatory and that coercive practices should not occur. Yet they are up and down the country. How will you address this so nurses feel safe to say yes, no, or not right now without ridicule, bullying, or fear of job loss? How can you support us to address the issues of treatment being declined and coercive practice being used on the public if they do not wear a mask, test, or have vaccination? Unless there is clear guidance in place to address these points and inconsistencies within the trusts, I would ask, are the NMC allowing this practice to continue, and with the nurses who are scared to speak out left to feel even more powerless to challenge this practice? And I'm not going to read them all out, but please read the code of conduct, and I'll just show you the list of breaches that I can see have been breached with the code of conduct. So that's got all of these breaches. So all of those are breaches of the code of conduct that we're supposed to be able to do, but unfortunately it seems like what is said, what is on websites, what is in printed documents, and what actually happens within practice are two very different things. And I feel we really need to start having some very uncomfortable conversations. I'd like to normalise debate and discussion, even if we feel uncomfortable, because projecting our feelings onto others and calling each other names to shut each other up is easy. What is difficult is listening and being compassionate, even if we don't agree, and considering that someone somewhere has had a very different experience to our own. This is especially important to encourage debate and discussion and compassion at a time where the media is weaponising one virus against us to stop us asking questions, and where the media is encouraging divide between nurses and pitting us against each other. We were never in nursing for praise. We do it because we like helping people, and that's all people.
Stand back, guys, if you're not.
There we go. So what next? I'm requesting a meeting with the NMC to discuss the issues being reported to me and how they can be investigated and how we can learn from our mistakes, and set in place short-term and long-term actions. Not just words and websites and leaflets that say nice things, but action and what we should be doing in practice. I also want to help connect people right now, as it can be a very lonely time. I'm wanting to raise awareness of the public that nurses are struggling, and the commitment that I make to the nurses who don't have a voice right now is that I will walk every city in England, Scotland and Wales to raise awareness and to help those nurses find their voice. And after that, I need to pass it on to each and every one of you who knows that something must be done. I encourage you to find the courage to do what is right. Read your policies, procedures, learn your rights, see how your unions and trades and trusts can help. Seek employment law advice and document everything. We all need to find the courage to do what is within our power and in our control. And it doesn't need to be public, but it does need to be done. I'm scared they'll make an example of me to shut me up. I am scared they'll make an example of me to shut others up. I'm scared they'll start digging up the exes in the closet and the people who I've said no to and who still hold a grudge. I'm scared of the impact of my ability to pay my bills for being so public. I'm scared they'll just start to make stuff up to shut me up. I'm scared this won't reach the person that it needs to hear this message, and I'm scared that my attempts won't be enough to make a difference. But one thing I'm not scared of is my conscience. My conscience will be clear, and I will know that I did everything within my power, and I can say that I tried. I had a choice. Do I face the consequences of taking my actions, or do I face the consequences of self-preservation? I am scared, but I encourage you to feel the fear and to do it anyway.
Yes. I don't think they can hear you inside, guys.
I think it must be like soundproof.
Yes, that one. Should we go and post it then?
Yeah. What about having a photo?
Yeah? Are we ready?
Yeah.
Am I doing a cigarette? Is it not in the way?
There's an apple core poking out. That was me.
Hook or crook, they're going to be
I was going to throw it over. Waiting. Why are we waiting? Why?
You need the coffee. And I think as well, like, you know, the support there, people there, that you know, it's very easy to discredit one person when there's more people, and there'll never be enough. You know, you've got 5 nurses, oh, it's just 5. You've got 10, you've just 10. Like, but numbers will bring numbers, and then I think it's the public that we need to support and let them know that we're really struggling.